Welcome back to Great Day. Okay, take a look at these pictures. A few years ago, I started packing on pounds even though I hadn't changed my diet. I was tired all the time and I just did not feel like myself. Getting the right diagnosis and the right treatment plan for me made all the difference in the world. Our next guest went through the same thing herself and as an OBGYN set out to understand true wellness as part of her practice. Welcome back, Dr. Drshelenalaljiaesthetics with the Dr. Shel Wellness and Aesthetic Center and one of her revitalized patients, Marie Sharp. All right.
Hey, how are you?
So, every time I would tell the story of all of a sudden, especially after having my son, that I would feel just blah on the whole bit, and I'm like, that's not me. I had no energy. I would go to sleep early, but wake up tired, be tired all day. You went through the same thing.
Absolutely. So, you know, I always say we don't find our mission finds us. And I think that we all go through things that changes the course of our life. So after practicing OB-GYN for well over 10 years, I myself, after I had my second child, Zaid, you know, I started feeling all of those symptoms that you're mentioning. So weight gain, fatigue, just exhaustion, insomnia.
Yeah. And the doctor told me, well, I said, why do I feel this way? He goes, well, you're old and had a baby.
There you go. And that is not a reason, okay?
Yeah.
So I went to my OB-GYN and lo and behold, and I'll make the story short, when I expressed all of these symptoms to her, including chunks of hair loss, right, and the weight gain and exhaustion, she said, you know, you have depression and you need something to help you sleep. So off I go with 2 prescriptions and I said,
Yeah, I had 5 prescriptions.
I am not depressed.
And my thing was I just knew enough, you know, with friends like you, I knew enough to say, I can't medicate my symptoms. I got to find out what the problem is.
Exactly, and I was not deficient in Prozac. I was not.
Yeah,
so I was deficient in bioidentical hormones. So that's where my journey started. And I knew that me as an OB-GYN, if I'm feeling that way, millions of women are struggling with that and going home with prescriptions of things they don't
need. You now
need.
Understood when they come in your office and go, I just don't feel okay.
Absolutely.
Marie, what was happening with you?
So what was happening with me was I was just feeling tired all the time, major brain fog, just weaker, I just felt my immune system was down, and when I went through and did all the testing and got it all right, and then I started with the BioT pellets, it was life changing for me.
It totally is life changing. I mean, I would not be out of bed. You would know Deborah Duncan. You would not know this girl. Okay,
okay.
So
the same girl.
Yeah, when we talk about bioidentical, let's compare bioidentical to. I know I was given some synthetic things before, and my body just was like, it just didn't like it.
Well, we don't have the receptor sites for it. So bioidentical stands for biologically identical to what our bodies produce and what our cell receptors actually recognize.
Your body think that
that's
your
right.
is doing it.
So it's essentially us producing our own hormones.
So for me, it was thyroid, progesterone, right?
Yes, and so thyroid and progesterone is what a lot of people start off with in their 30s and 40s. Once they hit menopause, the estradiol is added, but again, bioidentical natural, so it doesn't have the risk factors associated with the synthetic hormones. And the most important one that we know about now that we actually really use a lot is testosterone, because it used to be decades ago that we would think testosterone is only for men.
Right.
Well, men really need testosterone and they should be tested as well.
They have more, but we have some naturally
but we absolutely need it. So, our range might be, I might give women 100 milligrams pellet for women, but 2,000 for men. So you see the difference. But we need it for our motivation, weight loss, muscle mass.
Like for our motivation, she said. We need it for. Okay, so
get up and get going, girl.
But it's also good for our muscle mass, for heart health.
Muscle mass, heart health. Of course, libido and just strength. Our memory, brain fog, brain function is very important. Mental clarity.
Okay, it made all the difference in the world for me, for you, for you.
Absolutely. And it's easy because you don't have to keep applying creams.
Okay, so that's part of your wellness part.
Yes.
And then you have the aesthetic part. So now that you feel good, and you're looking at your body going, okay, I need some things to kind of change here, here, and here. We don't have to have a nip tuck so much anymore. There are other things we can do before that.
Absolutely.
Vanquish Me is one of them.
Vanquish Me is one of them. So what we've started doing, Deborah, is something called shell sculpting. And we call it shell sculpting because just like we did on the wellness side, where we customize your hormones, nutrition, IV therapy, all of it, right? We start with a detoxification, which is the 14-day detox, and we look at something like that, which you're seeing is look at that. And that person has had Vanquish Me, which is completely non-invasive, uses heat. So it uses radio frequency to get those fat cells to actually go through apoptosis. So we're not shrinking.
Which apoptosis, basically, they die and they go,
Well, you don't want to shrink the cells. You want to get rid of them, and then the detoxification gets rid of them. So you use Vanquish Me, we use it when there's large areas, COOLSCULPTIng we use for smaller areas.
Yeah, hence the word sculpting. You sculpt areas that just are kind of stubborn pockets of fat.
So we customize it and do it as a combination, and then we have EXILIS Ultra to actually tighten the skin. So we actually have a very, very customized approach where it's not a one-size-fits-all anymore.
Yeah, all right. Yeah. So we know what you did on the inside.
I may need a little VANQUISH.
You may need it.
Yeah. Well, make a little extra. So we're looking at what ULTHERAPY can do for the face and the eye area.
Yes, so we have ULTHERAPY, which Marie's had done, and the EXILIS Ultra. So we're trying to, a lot of us look at mirrors and say, I want to lift this up a little bit instead of surgery, because who wants the downtime and the risk? You want to lift up the skin naturally and stimulate the collagen. So ULTHERAPY uses ultrasound technology. EXILIS Ultra uses a combination of ultrasound and radio frequency. So it's beautiful.
Yeah.
And so it's tightening, stimulating collagen, pulling everything up, as well as we have products to remove the melasma and the pigment and the large pores and the wrinkles and all that. So really you're left with, you sculpt the body, right, non-invasively and non-surgically.
Right.
Then you go to the face, the neck, the loose skin, right, stimulate all of the collagen there, and then you kind of fine-tune it with things like the dermaplanes, the hydrofacials, as well as the laser procedures to stimulate the collagen.
Yeah, okay, there's like the rejuvenation of the skin.
Yes.
And then there's other rejuvenations.
And she's going to pause now.
Of other parts of the body. As I said, she is an OBGYN also. And so whether it's with age or women who've had several children, one of the things that happens is the whole pelvic floor issues. Like, you laugh and you go, uh-oh. Or you jump and you go, uh-oh, right?
Yes.
And so there are things that can be, there's a way to tighten that non-surgically as well.
So think about 65 million women in this country going through this process of the uh-oh. And it's a real medical issue, right? It's an embarrassment. A lot of women don't want to leave their house because of the uh-ohs. So the urinary incontinence.
You can tell when you have all the commercials on panty liners, and stuff like
that.
But seriously, and that's the reason why, because it's an issue.
So up until recently, it was either surgery or it was medications with a lot of side effects. Okay, so now we've got an actual device. It's an electromagnetic device called the Emsella. It's a chair. You come in 28 minutes later. In 28 minutes, it's like
there's a chair right there.
There it is. And see, she's reading a magazine. She's perfectly comfortable.
I'll pull that chair up to my dining room table.
Well, we can, right? So 28 minutes, it's like doing 11,200 Kegel exercises.
Wow.
I mean, it is amazing.
Yeah.
So it's even been approved for men for incontinence as well as sexual dysfunction. And sexual dysfunction is something that we talk about very openly in our office, but a lot of people seem to be embarrassed about.
Yeah.
But I always say it's a part of life that you need a safe place to be able to talk about it.
Right.
Because it affects your marriage, your relationship, and everything. Self-esteem. More than forget the partner. Look at the self-esteem.
Right.
So the chair does that, and then the lasers, the vaginal rejuvenation lasers, will help you with, the moistness, the pain, the laxity.
Taking it back to the way it was.
Taking it back to the way it was.
All right. We mentioned hormones earlier, but I wanted to touch on the delivery method. So you can take the pills, like, I take my thyroid, stuff like that. But there's also a thing called the pellet.
Yes.
And you have the pellet, you have the pellet.
Yes, I do.
Tell us how the pellet works.
Right. So the pellet actually looks like a little small grain of rice, and that's your testosterone. And literally the estradiol pellet is a tiny, tiny thing, like the head of a pencil tube. So what we do is every 3 to 6 months, depending on the person, customization again, we make a tiny incision and we insert it. And the pellets is a slow release according to what your body needs at the time. So if you're working out, you're going to have more release. If you're just stagnant and relaxing, then you're going to need less release. But it lasts for 3 to 6 months, depending on what we're using. So it's convenient. It's also bioidentical. And that's, to me, it's got to be natural for me to do it for my patients. So I have a lot of patients who still use the creams or who use sublingual, but never, ever, ever should you use estrogen or testosterone orally, because it does go through the liver pass and then it does increase C-reactive protein and inflammation.
Okay.
So with those two, I'll either use sublingual, cream, or pellets.
Yeah.
And that's the best thing. How have you liked it?
I've loved the pellets. I think that they're amazing. I've noticed that just being stronger, like just my strength overall, not only physically but mentally.
Yes.
Yeah.
Yes.
No more brain fog.
Yeah, and Marie and I have Marie and I have a lot in common, and both of our husbands have ALS, unfortunately.
So stress is another
stress
thing that you're dealing with.
Stress is huge,
Yeah.
and so both of us need all the energy being caregivers, and so do millions of other women and men out there. They need the energy. Men need pellets too. We have so many men who come in for testosterone pellets because they feel like their life is not the same anymore.
Yeah.
They have so much brain fog and lack of energy and low libido and no muscle mass. So men too, just like women, they go through andropause. So we always say—
Yeah, my mom always said, she goes, women go through menopause, your daddy's going through something too. So, yeah, trust
Yes.
me, it has a name now, Mom. It has a name,
Exactly.
andropause. Yes.
Absolutely.
All right, we need to have like a Shel therapy party.
There you
right?
go.
Right? But by the way, when you go to her office, it's beautiful, the whole bit. But thank you very much.
It's great to be here.
The Dr. Shel Wellness and Aesthetic Center has a special offer for Great Day Houston viewers. The first 25 callers get a free copy of Dr. Shel's book, a free B12 Slim Shot. Yes, I said B12 Slim Shot. And Mcella incontinence treatment, along with 20% off all laser treatments and 25% off body sculpting. Call them now at 281-313-7435, 281-313-7435. And for more information, log on to drshel.com.